After checking in, you will enter the preoperative department. There, you will meet your nurse. You will be asked to change into a bear hugger. This is a gown that is connected to a machine that blows warm air over your body. Again, this is to help prevent any infection. We can lock up your belongings, or you may give them to your coach or family. At this time, you will be asked to lie on a stretcher. Your family is welcome to join you at this time. Your nurse will go over your current medications and may ask you other questions that we would like verified. We will check your vital signs and begin IV fluids. Patients are given IV antibiotics. These are preventative against infection. The first dose is given just before surgery, while additional doses are given later that evening. Once you are settled in, the nurse will ask a volunteer to bring your family to the preoperative department so that they may stay with you until it is time for your surgery. During this time, you will meet with the anesthesiologist. They will discuss the details of your anesthesia. General anesthesia is used for spine surgery. This anesthesia affects the whole body. You are completely unaware of your surroundings and will not respond to stimulation. With general anesthesia comes an intubation tube. This allows the anesthesiologist to monitor your breathing throughout the surgery. When it is time for your surgery to begin, we will bring your family to the waiting room. They are welcome to remain in the hospital or leave the premises. You will be wheeled into the operating room and our medical team will begin to prepare for surgery. You will feel additional IV lines being placed. Staff will be covering you with blankets as it is often quite cold in the operating room. The circulating nurse will be available to you should you have any last-minute questions or concerns. The length of your surgery will depend on the type of procedure you will be having. You and your family will be told how long you should expect to be in the operating room. While you are under anesthesia, we will place a catheter in your bladder. Before you wake up, we will remove it. The first time you urinate afterwards, you might feel a slight burning or see a bit of blood. This is normal, but if it persists, alert your nurse. Once the surgery is complete, our staff will place you in your hospital bed. You will then be brought to the post-anesthesia care unit or PACU. The length of your stay in the PACU will be determined by many factors, including the type of procedure and the nature of the anesthetic used. We also want to make sure your pain is under control, and we need to monitor your wound. Generally, patients remain in the PACU for 1 to 2 hours. Family members are welcome to visit and will be notified by our state-of-the-art paging system once you are ready for visitors. Next, you will be brought to your hospital room. All rooms at Connecticut Orthopedic Institute are private. We have many team members ready to care for you, but with so many faces, it can get confusing. Besides wearing our badges and writing our names down on your patient whiteboard, we have also color-coded our uniforms. Staff in light blue are the physician assistants. These licensed, thoroughly trained medical providers work closely with your surgeon in the operating room and monitor your care during your entire stay. PAs examine you daily and are in continued communication with your surgeon. Nurses will be seen wearing royal blue scrubs. Our dedicated team is essential to the care and the recovery of our patients. They have expertise in the postoperative needs of an orthopedic patient. Clinical care associates will be seen wearing green scrub tops. These staff members will provide care to you in the hospital, such as vital sign monitoring, bathing, or toileting. Team members wearing maroon are physical and occupational therapists. Physical therapy trains you to be safe while walking or when you transfer in and out of your bed. They will also provide you with strengthening exercises. Occupational therapy retrains you how to self-care while maintaining any precautions. Environmental services, who wear a flowered top, and our dietary partners in gray, are our valued team members who you will see throughout your stay. Our goal is to make your experience exceptional, and we strive to provide a clean environment and tasty meals. Each floor has its own private kitchen, allowing meals to be delivered swiftly and at the appropriate temperature. Once in your hospital room, your nurse will provide you with information on your surroundings and any equipment you may see. Normally, as we walk around, we use our full lung capacity. When we find ourselves laying or sitting for longer periods of time, we tend to do more shallow breathing, and this can lead to pneumonia. An incentive spirometer is a small breathing apparatus that allows you to exercise or use your full lung capacity to prevent pneumonia from occurring. Your nurse will show you how it works. We encourage you to take it home and continue with your exercises for at least 1 week. As stated earlier, you will be given IV antibiotics, and you may see this hanging on your IV pole. Along with that is often a bag of saline fluid. This is to prevent dehydration. Once you begin drinking fluids, we will be able to remove the saline. Each surgeon will determine the best dressing for each patient. Some may use a gauze dressing requiring periodic changes. Others may choose to use an Aquacel or Mepilex dressing that may remain on for longer periods. You will be provided with instructions on your wound care before you leave the hospital. If you are aware of any allergies to adhesives you may have, please inform your surgeon prior to surgery. While in surgery, your surgeon may decide to place a drain. There are many different types of drains. The drain will have a small tube placed near your incision and held in position by a few stitches. The tube then connects to a container that allows our staff to monitor the amount of blood and fluid coming from your wound. If this is required, it is often removed the next day. You will not be discharged home with a drain in place. Blood clots are a risk after surgery. When we walk around, the action of our foot hitting the ground and the contraction of our muscles help push blood back up to the heart. By sitting or lying for long periods of time, it puts us at risk for forming a blood clot. An important exercise while lying in bed or sitting in a chair is to do ankle pumps. Stretch your legs out in front of you and point your toes forward. Next, pull them back towards you. Repeat these movements throughout the day. Besides medication and exercises, we have a third way to help prevent the formation of blood clots. During your hospital stay, you will be wearing sequential compression sleeves. A sleeve is placed around each calf. This is connected to a machine that slowly inflates the sleeves with air and gently squeezes your calf, helping the blood to return to your heart. After a few moments, the air will release and the sleeve will deflate. This process will then repeat. When it comes to medication, things can become confusing. In addition to your normal medicine, you will now be receiving new medication specific to your surgery. The manufacturer our hospital uses is most likely different from the one your pharmacy does. Therefore, many patients are apprehensive about taking pills that look different. Medications can also have generic or trade names. Your nurse will always provide you with the name of each medication you are to be given and an explanation of its purpose. But we encourage you to ask questions. We would never want you to accept medication or a treatment you are not comfortable with. Our staff wants to make sure you are as comfortable as possible. One way is to keep your pain under control. We use this pain chart so that you can help guide us to how much medication is required and its effectiveness. A rating of 0 tells that you have no pain, while a rating of 10 will let us know you are in extreme pain. There are different options we can provide for pain control. Your surgeon will order you medicine in pill form that will begin to work roughly 30 minutes after taken. Some may also prescribe long-acting medication. This pill will often last 12 hours and will be scheduled for twice a day. However, if neither of these are fully helping, you may be given medicine through your IV. This is a fast-acting medication designed to get you over the hump while we try to adjust your other pain medication. You will not be allowed to have the IV medication at home. We have already spoken on a few ways we try to prevent infection: staph testing, Hibiclens cleanser, and keeping your body temperature warm. But most importantly is hand washing. Whether in the hospital or home, it is imperative that you and your family maintain good hand washing. To wash your hands properly, you should be wetting your hands and applying soap. Rub your hands well. Remember to get between your fingers and under nails. While washing, you should sing Happy Birthday to make sure you are doing this for the correct length of time. Purell hand sanitizer is provided throughout the hospital. All medical and non-medical staff should be using the Purell before entering your hospital room and upon exiting your room. Earlier in the video, we discussed getting your nares swabbed so that we could test for staph. One type is methicillin-resistant Staphylococcus aureus, or MRSA. Should you test positive, you will be given medicine to place in your nares prior to surgery. You will also be given an IV antibiotic specifically for this type of staph. Our staff will be required to wear gloves and yellow gowns when entering your room. You will be considered MRSA positive until you have 2 negative tests. This is all done as a precaution to help prevent the spread of infection and protect patients. We have a lot to accomplish in the short time you are with us at the Connecticut Orthopedic Institute. You will have multiple therapy sessions. You have nurses and aides continually in your room for medication and providing personal care. Doctors and physician assistants will be assessing your medical well-being. Members of the phlebotomy team will need to draw blood. And you need to eat. Furthermore, sleep is a critical component to the healing process. We do our best to give you time to rest, but there are necessary check-ins. It is important to try to nap throughout the day whenever you get the opportunity. Our number one priority is your safety. Patients are often surprised by how quickly they are able to get up and walk around. Unfortunately, this can lead to patients forgetting to call for assistance. While you are with us, we ask that you always call for a staff member before you get out of bed. If we assist you into the bathroom, please do not attempt to get back to your bed or chair by yourself. Your surgeon may recommend you have physical therapy prior to surgery to help strengthen your core muscles. This will depend on how much pain you are currently experiencing and on your insurance coverage. Immediately following surgery, you will be asked not to partake in active therapy. That is to say, you are not to perform any exercises or movements involving bending, lifting, or twisting. Though you will have some restrictions after surgery, physical activity is essential. Getting up and walking helps prevent blood clots, pressure sores, and pneumonia. Connecticut Orthopedic Institute has its own gym, which includes required durable medical equipment, a staircase, and car setup to prepare you for discharge home. Therapists speak with your nurses to try to coordinate your pain medication so that it is given approximately 30 to 60 minutes before your therapy begins. Our nurses and aides are trained to assist you to walk throughout the floors even after your therapy sessions.